I'm Dr. Stacie Grossfeld. I'm an orthopedic surgeon in Louisville, Kentucky. I'm going to talk a little bit today about the meniscus. Each person has two menisci in each knee. You have one on the inner part of your knee and then one on the outer part of your knee. So we call it medial and lateral. And the meniscus functions as a shock absorber. So it provides some cushion between the two bones in your knee, between your thigh bone, also known as your femur, and the shin bone, known as your tibia. So the meniscus sits right between the two bones. But it can tear. And when it tears, it causes a sharp stabbing pain involving the knee joint. And the pain is quite localized. So patients will tell me, I felt this sharp stabbing pain. It's always in the same place, and it can worsen with activity. It can cause swelling involving the knee. It can cause popping, locking, clicking, and also some signs of some subtle instability involving the knee. But the most consistent symptom that patients will complain of is a reproducible sharp stabbing pain. So for example, if a patient tries to squat, they'll always feel that sharp pain involving the knee. Some different types of diagnoses involving the knee. The pain can migrate. Sometimes it's on the outer part of the knee, sometimes it's on the inner, sometimes it involves the kneecap area. But when you tear your meniscus, it tends to always be in the same location. So what do we do about a meniscule tear? Well, in patients that don't have advanced arthritis, we recommend a knee arthroscopy. And that is a 15 to 20 minute outpatient procedure where 3 little tiny holes are made into the knee joint. A little TV camera is inserted into the knee joint, which is about the size of a pencil. At that point, the knee gets projected up onto a video monitor. Your surgeon can see the whole inside of the knee joint. A small pair of microscopic scissors called a punch is then used to remove the part of the meniscus that is torn, followed by a buffing device, also called a shaver, that smooths out the edge where the meniscus was torn. On occasion, we can actually sew the meniscus back into position. That's rare, and that typically occurs with patients that have a ACL injury. They tend to tear their meniscus in an area that can be repaired. So most patients, we just remove the part of the meniscus that is torn because it's just not repairable. Again, on rare occasion, there are meniscule tears that occur that we can repair, but for the most part, we end up removing the part that is torn. Thank you.